Welcome to Virtual Visits, Making the Most of Video Calling with Healthcare Providers. This webinar is for people living with dementia and care partners supporting a person living with dementia, whether that be someone who is social distancing at home in the community or living in long-term care. Video calling offers many benefits over traditional phone calls. Communication becomes much clearer when you can see the other person's body language and facial expressions, and you're not only relying on speech to communicate. We've heard from several care partners and people living with dementia how important being able to see someone's lips is in their ability to understand what they're saying. Seeing someone while you're talking to them also helps to remove the feeling of distance. It brings the person into the room with you. You see the light in their eyes when they laugh and the gentle head nod or the head tilt to show that they're listening. It enhances that feeling of connection and closeness. It allows you to celebrate milestones together from a distance and to continue building those memories. Video calls also allow us to support one another in our day-to-day activities, such as helping someone to read their mail using video or identifying potential safety hazards in the home. Consider what the needs of the person you're calling are and what the purpose of the call is. Is the call purely for social reasons, or are there other needs that can be met with a video call? What are their needs now, and what is likely in the future? For example, watching your mom get up off the couch during a call may suggest to you to start looking at furniture that is more supportive of her mobility challenges. Something higher that is more firm with armrests to push up off of, for example. Do you have a specific goal in mind that you want to accomplish in the call? For example, if you're worried about the person's health, the call may be a way for you to get first-hand information on how the person is doing or what their living environment looks like. Identifying the purpose of the call is a great first step to ensuring that you're prepared for the call and can get the most out of your virtual visit. So in this video, I'm going to focus on virtual appointments with healthcare providers. For more information on using video calls to assess the health and safety in the home of someone you're calling, or for social purposes, please watch our recording titled Virtual Visits, Making the Most of Video Calling. In that recording, we talk more about how you can enhance your calls to increase your chance of success when calling someone who lives with dementia. For many of us, virtual appointments with healthcare providers are one of the truly good things to come out of this pandemic. While you may have heard the terms telehealth, digital care, virtual care, or remote care at some point in the past, this remains something that was primarily used in rural or remote areas, with slower adoption in more urban communities. In Canada, we have made more progress in the expansion of and our acceptance of virtual healthcare in recent weeks than we have in years prior. With the greater availability of higher speed internet connections and access to smartphones and tablets, virtual healthcare visits offer continued access to doctors, nurses, specialists, social workers, and so on, without the added time and fuss of getting to and from your appointment and the added risk of exposure to illnesses. Now, depending on where the person living with dementia is at in their progression, a virtual visit with their physician using video or telephone can be a less intimidating way of accessing a doctor, whose masked face could be a source of anxiety or fear during an in-person visit. A video call in particular can also give the doctor a small window or a glimpse into your home environment, which can help them in their understanding of what may be going on for you and your family. Keep in mind that a video call may also be disorienting and confusing for some people living with dementia, depending on where they're at in their progression. So some tips for getting the most out of your virtual visit with a healthcare provider are: prepare for the call. So many clinics are now using some form of an online or telehealth platform where you receive a call from a physician directly at the scheduled time, where you're emailed a link to connect to your doctor and are asked to log in and meet the physician in a virtual waiting room at your appointment time. So about 15 minutes before your scheduled appointment, check your internet connection, your audio, and your video. Visit your clinic's website or follow the email link that was sent to you by the clinic if you received one to the software that you'll be using to join the call. Now, most video calling software requires that you install an app or some sort of plugin the first time that you connect. So you may see a window pop up in your browser asking you to share your camera or your sound. Now, be sure to accept this or your doctor won't be able to see and hear you during the appointment. Complete any required consent forms and enter the virtual waiting room or be ready for your scheduled phone call approximately 10 minutes prior to your appointment time. Now, don't be concerned if your doctor doesn't arrive right at the scheduled time. Just as at an in-person appointment, your doctor may be running a few minutes late. Now, if you know that your Wi-Fi tends to cut out frequently or you have some issues with call quality, consider using an Ethernet cable to connect your computer directly to the internet for a better connection. And also consider asking your doctor's office if they have their own list of tips or instructions for connecting to help you get the most out of this virtual visit. Send any important forms or photos in advance. So for example, if you have a skin issue, draw a circle around it on your body with a washable marker and send a photo of this to your physician before your appointment. Having a close-up photograph of an issue might be preferable for some physicians rather than trying to show them during a call, where cameras can lose focus when they're moved around and it can make it a lot harder to see the issue that you're trying to talk about. So ask your clinic what their preferred way is for receiving these photos, such as through secure email or an online portal. Check your vitals. So if you know or anticipate that your doctor will need to know your vitals for your appointment, and you have the equipment needed at home to do this properly, such as a blood pressure cuff, thermometer, glucometer, weight scale, etc., then it may save you some time during your appointment to check your vitals and have these numbers ready for your doctor in advance of the call. If you think that your doctor may need to see where concern is on a part of your body and you haven't sent this photograph in advance, then wear loose-fitting clothing that's easy to manage so you can easily show the doctor what you're talking about without having to fuss around with some tricky buttons. And lastly, follow the rules of effective appointments with healthcare providers. So what was applicable before COVID-19 is still applicable now. Write down what you need to discuss with your doctor before the visit. Identify what is your top question or concern for your doctor and lead with that. Try to summarize your issue into 1 or 2 sentences if possible, and provide additional information as it's necessary. Take note of what your most urgent symptoms are and how they've changed or what medications or treatment they respond to, if any. Now, it can be more challenging to stay on topic in a virtual call, so writing down your concerns and what you've noticed about them can help you to stay on topic and get the most out of the limited time that you have with your doctor. And if you keep any health or medication or symptom logs where you track issues relating to your health, be sure to have these next to you during your appointment so you're not searching for them if you're asked a specific question that you would need to look up the answer to. Bring in a support person if possible. Have a family member or friend join the call either in person if they live with you or remotely if the doctor's office allows for multiple people on the call. This person can be your note taker, allowing you to focus on the conversation with the doctor, or they can be there to remind you of the questions that you wanted to ask or to ask follow-up questions in the moment that you might not have thought of for yourself. Set yourself up for call success. So as much as possible, try to receive the call in a private and quiet space. If you're calling from a smartphone, consider blocking incoming calls for the duration of your call to reduce potential distractions and make sure that your device is fully charged or plugged in. I'm sure many of us have been there where you've forgotten to charge your phone and are reminded of this at the worst possible time. As much as possible, try to remain flexible and patient. Your call may get dropped, you may have trouble connecting, your audio or your video may be choppy and freeze, and while you may be tempted to just throw your device across the room, instead take a deep breath and give your device a minute or so to work itself out. If the problem does not resolve on its own, then consider getting some help. Sometimes it can be something as simple as needing to join the call from a preferred browser, such as Chrome or Firefox. And sometimes we do the best we can, but the technology may still just not be our friend that day. The fact that you're here on this webinar with us shows that you are a flexible person who is open to trying new things, and you already have the skills it takes to have a virtual healthcare appointment. In worst case scenario, you pick up the phone and you call the clinic. Now remember that a true emergency is a true emergency. And while virtual visits with healthcare providers can be valuable for straightforward concerns, there will remain some things that require an in-person visit. If you have any questions about the information you've heard here or other questions about living with dementia, please don't hesitate to call our First Link Dementia Helpline. English services are available Monday to Friday between 9 a.m. and 8 p.m. Thank you very much for taking the time to watch this webinar today. I wish you all the best in your video calls.